So hello guys, welcome to our channel Niperian Solutions. So today we are going to discuss about the antimalarial agents, right? So MCQ on the antimalarial agents. So let's start with the first MCQ. The erythrocytic scintocyde antimalarial drugs are used as, right? So what are the options? Suppressive prophylaxis, clinical curative, radical curative, or both A and B, right? So what is the answer here? The answer is both A and B. Means erythrocytic scintocyde, that is used as a suppressive as well as a clinical curative, right? So let's see just some discussion about this one, like what are the different sites and all, right? So here are the different stages of the like malaria cycle. So there are main four stages, that is pre-erythrocytic, erythrocytic, exoerythrocytic and gametocyte, right? So these are the stages and what are the drugs acting on it and what is the clinical use of that different stage. So in pre-erythrocytic, that is only casual prophylaxis, right? And what are the drugs acting on it? So these are the progonal, pyrimethamine and primaquine, right? So accordingly erythrocytic stage. So in erythrocytic stage, clinical cure as well as suppressive prophylaxis. So that is our question. In erythrocytic stage, what is the uses of the erythrocytic stage? So answer is clinical cure and suppressive prophylaxis. And similarly for exoerythrocytic and gametocytes, right? So these are the some points regarding the different stages of the anti-malarial drugs. So there is one important point regarding the exam point of view, that is the primaquine, right? Here also I have highlighted that primaquine. So primaquine is act on all stage of malaria cycle except erythrocytic stage. So here you can see the primaquine is including every stage except in the erythrocytic stage. Means in pre-erythrocytic you can see over here the primaquine. In exoerythrocytic, primaquine is there. In gametocyte also the primaquine we can use, but in the erythrocytic stage we cannot use the primaquine, right? So let's move to the second question now. The second question is chloroquine resistant Plasmodium falciparum malaria can be cured by the following drug except, right? So what are the options? Quinine, second one, that is the combination of pyrimethamine and sulfadoxine, then primaquine and the artesunate. So what is the answer here? So here answer is the primaquine, right? So except primaquine, that all the three drugs, quinine, pyrimethamine plus sulfadoxine and artesunate, these are used in the chloroquine resistant Plasmodium falciparum, but primaquine is not used in the chloroquine resistant Plasmodium falciparum malaria, right? Then the third question, the quinoline derivative used as a radical cure which is contraindicated in pregnancy. Just recently we have seen that the only one drug that is used in the radical cure, right? So let's see the option: mefloquine, quinine, primaquine and chloroquine. So just previously we have seen which drug is used for the radical cure, that is nothing but our primaquine, right? And which is also contraindicated in the pregnancy. So here are the drugs which are safe from the quinoline category. So chloroquine is the drug of choice in the pregnancy. Then quinine, that is also effective in the first trimester. Mefloquine, that should be avoided in the first trimester. And finally the primaquine, that is contraindicated in pregnancy. That is very very important. Then what are the falciparum malaria during pregnancy is treated by, right? If in the pregnancy there is a falciparum malaria, then what are the drugs? So there are the combinations used: quinine plus clindamycin in the first trimester, and in the second trimester, so means like second and third trimester, that is the artemisinin based therapy. So these are the some important points regarding like for the antimalarial drugs in a pregnancy. So that's why this question is very important. In the next one, other than antimalarial action, chloroquine is used as, right? The options are dermatophytes, intestinal amoebiasis, hepatic amoebiasis and microfilariae. So our option is the hepatic amoebiasis. Okay, let's see the uses of the chloroquine, right? So you have to remember the red Mg IPL, right? So what it is? R for rheumatoid arthritis, E for extraintestinal amoebiasis, right? Here is the one option B is there, intestinal amoebiasis, but here Chloroquine is used as a extraintestinal, and what is mean by the extraintestinal? That is nothing but the hepatic amoebiasis. Means chloroquine is used in a hepatic amoebiasis or extraintestinal amoebiasis, but it is not used for a intestinal amoebiasis. The next, D for discoid lupus erythematosus, then malaria, then giardia, then infectious mononucleosis. Right? Actually, the infectious mononucleosis is the disease caused by the virus. So, which virus? That is EBV, Epstein-Barr virus. So, that is also very important. Then photogenic reactions, then Leber reactions. So, in that all the categories, chloroquine is used. Right? These are the other properties like anti-inflammatory, anti-arrhythmic, local anesthetic, antihistaminic, smooth muscle relaxant. These are the other properties. But you have to remember the red Mg IPL. Right? Then the next question, the drug of choice for the cerebral malaria is. Right? So what is the drug of choice for the cerebral malaria? So what are the options? That is the quinine orally, then mefloquine, then again quinine, but that is the IV route, and then chloroquine. So there are the four options, but what is the answer? We are using the quinine, but what is the route of administration? That is the IV route. Because quinine orally, that is not the drug of choice for the cerebral malaria. Right? So let's see where quinine orally used. So it is used for the chloroquine resistant falciparum malaria only for treatment, not for prophylaxis. Right? Quinine used, but only for treatment, not for the prophylaxis. Right? Quinine stimulate the myometrium and can cause the abortion in early pregnancy. That point is also very important. Right? So the next question. Okay, before going to the next question, just see the some important points regarding the mefloquine. So just we have seen used for the chloroquine resistant Plasmodium falciparum malariae for treatment as well as prophylaxis. And what about the quinine orally? If we are giving the quinine by the oral route, that is only for the treatment, not for the prophylaxis. But mefloquine used as the treatment as well as prophylaxis, right? That second point, it can cause a cardiac conduction disturbance, psychosis and seizures. So contraindicated in CNS disorders. Very, very important point regarding the mefloquine. So this is the drug which is contraindicated in the CNS disorders, right? Then administer with halofentrin or quinine is contraindicated because it can cause the prolongation of QT interval, right? So we are not giving the mefloquine with the halofentrin and quinine. Why? Because these combinations can prolong the QT interval, right? Then what is the next point? That is effective as a single dose treatment. That is also very important. It is the single dose treatment for the malaria. Also used for the prophylaxis of travelers, like that not used for the residents of endemic era. One more important point, cannot given parenterally, means that is the oral drug. And here is also one important point, the mechanism of action is same as chloroquine, but site of action is different. So that is the parasitic cytosol, right? And what about the chloroquine? What is the mechanism, right? The site of action. The site of action is parasitic vacuole. Like these are the very important points regarding the mefloquine. So you have to remember the what is the site of action comparatively. Like for chloroquine, that is the vacuole. For the mefloquine, that is the cytosol. Then another important point, that is the single dose treatment. Then another important point is that is contraindicated in CNS disorders, right? And it is used for the treatment as well as prophylaxis. So these are the important points. The next one, which of the following is active form of quinine? So that is also very important, right? So here is the answer is 8S9R. So there are the just different derivatives or like stereoisomers of the quinine, like as we know quinine, quinidine, so that one, right? So we can see here are the different forms like quinine, quinidine and mefloquine, right? And what is the active form? So about the quinine, active form is 8S9R, that is the levorotatory, right? So quinine also like, so that product, what is the product of the quinine? That is synconidine, right? And what about the quinidine? So quinidine, the product is synconine. And what is the active form of quinidine? That is the 9S8R. And that quinidine used in the, like in arrhythmia and all the things, right? And in mefloquine, 11S12R, that is the dextrorotatory. Means among these three, like quinine is 8s9r, quinidine is 9s8r, and mefloquine is 11s12r. And depending on the dextran level, you have to remember this one. And this product also you have to remember. For quinine, the product is the synconidine, and for quinidine, the product is synconine. So that is vice versa. So please keep in your mind. Then the next question is, which of the following antimalarial drug is used in pneumocystis jirovecii pneumonia and toxoplasma gondii infection? Right? So that is also very important. So your answer is atowacone. Right? Right? Then what about pyrimethamine? Its high dose inhibit toxoplasma gondii. Then what about primaquine? Primaquine given with the clindamycin for the pneumocystis jirovecii in AIDS patient. Right? And what about the progonal? Progonal potentiate the action of atowacine. Right? But here for pneumocystis jirovecii as well as toxoplasma gondii, so which drug is used? That is the atowacone. Right? The next, which artemisinin derivative only given by oral route? Right? So there are the different route of administration for the artemisinin derivative. These are the endoperoxide ring present in the artemisinin. So here are the options are artesunate, artemether and arteether, then DHA and arteolin, then both A and B. Right? So here is the answer is DHA and arteolin. Right? So let's see what are the different route of administration of the artemisinin derivative. Like the first one derivative is the artesunate, that also called as the hemisuccinate ester. Very very important. Hemisuccinate ester. The only drug from the artemisinin derivative that is the hemisuccinate ester, that is the artesunate, and that is the water soluble. That point is also very important. Right? And it is given by the IV route, IM and orally. Right? Then artemether and arteether. Right? So artemether and arteether are the lipid soluble drugs. And artemether is given by the intramuscular as well as orally. But arteether, it is not given orally, it is only by the intramuscular route. And what about the DHA? DHA is just nothing but the reduced form of the artemisinin and arteolin. So arteolin is the trioxylin derivative, and that is given only orally. So that is our question. Right? So in the next one, which drug is converted into the active metabolite of triazine derivative which inhibit the plasmoidal DHFR enzyme? So what is DHFR? That is dihydrofolate reductase. Right? So what are the options over here? That is the pyrimethamine, progonil, atowacone and sulfadoxine. So what is the answer here? Here is the progonil. So progonil is the drug which inhibit the dihydrofolate reductase enzyme. So actually itself is not inhibiting the DHFR. So whatever the active metabolite of that progonil, that inhibit the DHFR. Let's see what is the active metabolite. So progonil converted into the cyclogonil, and that cyclogonil inhibit the DHFR. Progonil cannot inhibit directly the DHFR, so that's why it is metabolized in the presence of CYP2C19. That enzyme is very important. How the progonil is converted into the cyclogonil? That is the CYP2C19. Right? And this moiety is the triazine one. In cyclogonil you can see the triazine moiety, that is the active drug of the progonil, and which inhibit the actual DHFR, that is the dihydrofolate reductase. The next question, which antimalarial agent is contraindicated in glucose 6 phosphate dehydrogenase deficiency? Right? G6PD means glucose 6 phosphate dehydrogenase. There are many drugs, like if you are studying the pharmacology, so there are many drugs which is contraindicated in glucose 6 phosphate dehydrogenase deficiency. But mainly from the antimalarial, there is one drug which is totally contraindicated in glucose 6 phosphate dehydrogenase deficiency. What is meant by contraindicated? Means we have to avoid that drugs, right, in specific deficiency. So we have to avoid that specific drug in the G6PD deficiency. So what is that drug? There is nothing but the primaquine, right? So we cannot give primaquine to the patients which are already deficient to the glucose 6 phosphate dehydrogenase, right? So that is the important. So what are the adverse effect of the different drugs? So chloroquine, what are the adverse effect? So that is the bull's eyes maculopathy, that we can see that is the retinal damage, right? And the next one, quinine, that is the synchronism, black water fever, hemolysis, very very important, hemolysis is there, right? Then mefloquine, that we have already seen, the cardiac disturbance like prolongation of QT, that we have already seen, right? Then again psychosis, seizures, so that's why contraindicated in CNS disorders, that also we have seen. Primaquine, that is a myth hemoglobinemia and hemolysis in glucose 6 PD deficient patient, so and also contraindicated in pregnancy. So that table is very very important. So drugs from the antimalarial and what are the adverse effect of that specific drug. So in primaquine, so you have to remember that with hemoglobinemia as well as hemolysis in glucose 6 phosphate dehydrogenase deficient patient, right? And the next MCQ is the methoxy group at 6th position of quinoline ring is essential for the anti-malarial activity in. So basically that question is like what I can say, not from the pharmacology, that is totally related to the medicinal chemistry, or the question is based on the structure activity relationship, that is the SAR, right? So what is this? So what are the options? First of all, that is the 4 aminoquinolines, 8 aminoquinolines, then quinoline methanol, and both B and C, right? So what is the answer here? So here the answer is the 8 aminoquinolines, right? So just see the some important point regarding the SAR. Here is first of all the 4 aminoquinoline, the important assay in the SAR, that 7 group is substituted with the chlorine. Then in 8 aminoquinolines and the cinchona alkaloids, that is the 6 number, that is the methoxy group. And in quinoline methanol, what is the example of quinoline methanol? That is the mefloquine, right? So CF3 at 2nd and 8th position in mefloquine, right? So meflo, that flow means fluorine, and what is the position of that fluorine? That is the 2nd and 8th one, right? So these are the MCQs. Thank you. In the next video, similarly we will see the different topic, and in detail we will see the what are the MCQs from the pharmacology point of view. Thank you.